Hi, I'm Dr. Paul Jared Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. What I want to talk about today is fractional resurfacing, laser technology that has provided dramatic innovations in the field of laser surgery. Fractional resurfacing represents a technique in which lasers are used to resurface the skin. Resurfacing is used for acne scars, wrinkles, sun damage, stretch marks, or any imperfections, very much to replacing road. If you have cracks in the road or bumps in the roads or indentations in the road, we could use resurfacing to repave, and we do this very much for the skin. Now, in the past, we used a variety of lasers that were rather aggressive. They had increased risk, increased downtime, and may not have been effective as more modern-day technology. With using fractional technology, what we can do is we can get the benefits of the old technology with really minimizing the downtime and risk. And the reason why they call it fractional is because the laser is delivered in fractions. Microscopically, tens of thousands of columns of heat are delivered to the skin with areas of sparing in between. So the quicker healing and the safety comes from the untreated areas that are done in fractions. There are several types of fractional technologies out there. I prefer the Fraxel name brand. This is really these are the inventors of the technology. They have several different lasers today that work to resurface the skin in a full spectrum of skin problems. There are several copycat technologies out there, but I prefer the Fraxel name brand mostly because of their dramatic amount of clinical studies, their long history, and certainly because of their innovation. Now, there are three Fraxel technologies that exist today. The most traditional one is called the Fraxel Restore. It's what is called a non-ablative laser. So it delivers the heat without leaving open skin or open wounds like the older lasers do. This obviously provides dramatic amount of skin safety. Patients are able to go back to work within a couple of days and really just look like a mild sunburn. The other technology that is available is called the Fraxel Repair. This is a fractionated CO2 laser. This is certainly for more aggressive treatments, people who have very deep acne scars, very deep wrinkles, or severe sun damage. The fractional CO2 laser, or the Fraxel Repair, does leave open wounds and does have a solid week to 2 weeks of downtime. This is far better than the older CO2 lasers, which had weeks with an S, and actually had a much more difficult safety profile. So what's important is not only the type of technology, but for what candidate you're choosing to use it for. Someone who has mild fine lines and acne scars may do better with the Fraxel Restore. Patients with more severe problems or older patients may do better with the Fraxel Repair. With all the variations of the Fraxel technology that exists, it can be quite confusing. Here at the Fifth Avenue Dermatology Surgery and Laser Center, we are actually one of the few centers in the country that have all the Fraxel technologies. So there really is no best Fraxel device. What is really best is for the particular patient. There is overlap between the Fraxel Repair and the Fraxel Dual and what they treat, but very much choosing what's going to be right for the patient isn't just about which is going to give the best result. It's about which is going to fit into the right cost structure, which is going to fit into the right treatment schedule. With treatments such as with the Fraxel Dual, it does take several treatments. Most people get anywhere between 3 or 5 treatments over several month periods. With the Fraxel Repair, it tends to be a treatment because it does have downtime. It is only necessary to do it once, although there are patients who do it a second time. So there are really several options in order to treat a patient appropriately. And that's part of the skill in using this technology. It's not about just putting it on a certain setting. The technology is only as good as the judgment and the skill of the doctor using it. Here at the Fifth Avenue Dermatology and Surgery Laser Center, everything is physician performed. I'm responsible both medically and aesthetically for my patients, so I'm the only one actually performing them. Many common questions are, is there anesthesia, is it painful? And that certainly is going to depend on the nature of the treatment and which device we use. We are an accredited facility, so we can offer oral sedation, intravenous sedation, but for most treatments, particularly with the Restore, topical anesthesia for an hour is more than enough. For patients that aren't driving, sometimes we do offer oral medication, and certainly for the more aggressive treatments like the Fraxel Repair, we do offer sedation. None of these treatments require general anesthesia of any kind, and it's very rare that patients don't get through the treatments very comfortably. This is the Fraxel Dual. It has two of the Fraxel technologies in it, both the Fraxel Restore, again, which is a non-ablative device that has minimal downtime, mostly used for acne scars and fine lines. And also it has a second wavelength called the thulium, cumulatively being called the Fraxel Dual. The thulium works specifically for pigmentation, so for conditions like melasma or significant sun damage or post-inflammatory pigmentation of any kind. That is really the technology that works best for it. Now, all the Fraxel lasers look pretty much the same. They all have a cooling mechanism to protect the skin, which is built in, and they all work on a roller ball tip. So the technique is done across the skin, and I'm going to do a short demonstration of what that's like in a moment. But it's really quite simple. It's ergonomic. The safety profile is excellent, and again, the Fraxel name brand really has the most clinical studies to date to provide the utmost in safety. The Fraxel Repair, the only thing that's really different about the device is in the quality of the laser beam, which is one that actually will ablate the skin and cause a significant more amount of swelling and inflammation that does require some at-home downtime. So let's go to a treatment. We're going to have a patient, and we're going to show what it's like to get stretch mark removal. Okay, we're back. We're going to do a treatment with the Fraxel Dual, specifically the Fraxel Restore within the Fraxel Dual for stretch mark removal. This is the treatment head as we showed before. The air cooling is on. The roller tip is sterilized. The patient is sat with 1 hour of topical anesthesia. Sometimes if people are sensitive in certain areas, we'll offer a Percocet or a Valium or something like that, but usually topical does well enough. On the laser itself over here, take a look over here. With all the Fraxel technologies, there are several things that we're addressing. I can control the depth of the penetration of the laser. I can detect the percentage of fractional coverage of the device and the number of treatments. And all the Fraxel technologies work with these three parameters. This is really where the art of the treatment comes in, and how we could really get the best treatment for the patient. Coetzi, our patient here, is doing stretch marks in a sensitive area. She's type 4 skin, which means she's more olive tone. Therefore, we do have to take certain precautions with her skin. There are patients who are Caucasian with lighter skin. You can go more aggressively. But one of the advantages of this device, because it is non-ablative, and again, it means no cutting and no open skin, I can really treat all skin types with certain precautions taken depending on their background. It's a very safe treatment, and I'm going to treat the stretch marks here, and she'll look like a sunburn for a couple of days in that area. Let's focus in on the area a little bit. I'm going to press my foot pedal. Hopefully this will be very tolerable. We can see the stretch marks over here. Now I'm going to start with the roller ball tip. Everything is ready to go. You could probably hear that beeping. And if you get up real close, you may be able to see some of the actual pixels or the columns of tissue. The columns of heat that are delivered to the skin. They have a slight texture to them. They almost look like white dots. And I'm doing about a 17% coverage now. With every treatment, I'm sending 17% coverage of heat into the skin. So the treatment goes rather fast, particularly with the modern technology. And I'm just going back and forth, watching for redness, watching for any inflammation, making sure that it's a safe treatment. It is very important to note that a laser of any kind is just a fancy knife. So all these treatments, as safe and as good as they are really only as safe and as effective as the person doing it. So I would always say, be very wary of any practice or medi-spa where there's not actually a physician performing this treatment. It does take a skilled hand. It does take knowledge of laser surgery. And in many states in the United States, it's actually illegal for a non-physician to use a laser, period. In our state, in New York, there are nurses that can do this, physician assistants, but in my opinion, I would only have a well-experienced physician doing this type of procedure. Again, I'm the only one that would perform such treatment on patients. Everything can have potential complications, and with the appropriate skill and management, we can really minimize any of the risks while maximizing the clinical effect that you're going for. So Quetsy's doing very, very well. This area is almost done. I'm able to monitor on the laser exactly how much energy is going in to the skin. And as you can see, there's really just some moderate redness. She'll have kind of like a sunburn-like feeling for about 15-20 minutes afterwards. And her post-operative care will really just involve moisture staying out of the sun and so forth. We do not use the Fraxel repair on patients with dark skin. We can use it on the body in certain instances, but I do find that with the Fraxel Restore, you can come back to me, with the Fraxel Restore is really the best treatment for stretch marks. Acne scars as well, Restore does very, very well. If there was some pigment to the stretch marks, that is where I would use the second wavelength, the thulium, in addition to the Restore. So there's really a whole combination and variety of treatment protocols that we use. It really does take appropriate skill and judgment to determine what's going to be the best combination of things for the patient, for the skin type, and for the actual problem that we're treating. She's going to sit with ice for a couple of minutes, and she'll be done. She'll be able to go home, and I'll probably see her back in about 3 or 4 weeks. By the second treatment, patient should start seeing some results, but with every treatment, we can get slightly more aggressive, and she'll get more and more out of the treatment. Thank you.